Welcome to the first interview segment on this morning on ITV. I am Alhassan Bala. This is mostly a segment that we normally discuss issues that are related to either health or the current affairs matters. And today we are going to look at the issue of the implication or impact of substandard drugs in Nigeria. And the issue of substandard drugs has been an issue of concern by many stakeholders, which in 2020, a report by WHO says that about 30% of drugs in Africa are either fake or substandard. Well, substandard and falsified medications also pose a lot of significant risks to global health. And don't forget that 1 of 5 drugs in Nigeria is either falsified or substandard, which is actually causing a lot of loss to Nigerian government and also to the people. And don't forget that another report also said that about 12,300 persons normally lost their lives yearly or annually due to substandard drugs. And the economic loss by Nigerian government and people also cost about over 890 million US dollars annually. This is a huge amount of money. This is a huge number of people that are losing their lives because of the substandard drugs. And also the northern part of the country are actually the one that are taking this burden, because about 9,700 deaths occurs annually because of substandard drug, most especially the issue of anti-malaria drugs, and also it costs them 600 to 700 million US dollars annually. Well, a lot of issues and to discuss the issue of substandard drugs in the studio, I have pharmacist Yusuf Hassan Wada, who is a public health pharmacist and expert in drug abuse and health system strengthening advocate. Welcome to the studio.
Thank you so much, Alhassan. I'm very glad to be here.
Well, Yusuf, firstly, let's look at the issue of substandard drugs in Nigeria. What is your take on that?
The issue of falsified and substandard drugs have been an issue not only to Nigeria, in almost all developing countries and also globally. Although Africa and also Nigeria contribute a lot of burden, contribute a lot toward the prevalence of this menace. A lot of report has showed that Nigeria and also these African countries contribute to a significant burden, and almost a report shows that almost 48% is being contributed by African countries, especially Nigeria.
Okay, looking at the issue, regulation matters. The government, either Nigeria or other nations, have regulatory bodies, but still we do have this. What is the cause of that?
The issue of this falsified and substandard medicines doesn't start from manufacturing. It goes through the trends of medicines, from how they are being produced to how they are being distributed and how they are dispensed, and also how they are even being put in place, the storage facilities. Because when we talk about substandard drugs, which it means that these drugs have been authorized but fails to meet these standard or specifications being enshrined in the other official books or been approved. So when a drug has been approved, it has been manufactured and it has passed through those sequence of approval through the regulatory agencies, there is need for surveillance to see that are these drugs being stored, because these are chemicals. Drugs are chemicals that may deteriorate in no time. They may deteriorate because they are not being stored in good facilities, they are not being distributed how they could be, and also they are not being dispensed by those official that has been approved to do that. So when those drugs that are chemicals are being kept in temperature which is beyond their specification or out of those limit or specification, they tend to deteriorate to become substandard. While if we brought about the issue of falsified medicines, also is being drugs which are deliberately or misused, in the sense that they are fraudulently brought to the public because they failed to meet those their sources, their origin, or also the composition. This is the main difference between when we say falsified and substandard. When we see this falsified medicine is that they are being fraudulently used by other people to change those drugs which are not been approved. While when we see this substandard, they have been approved, but they don't follow the specification that has been enshrined. So when we talk about this substandard, we shouldn't be staying on regulatory agencies. What do we have within our own policies? What do we have within our own laws to see that those drugs, not only that they have followed those specifications for manufacturing, but also they have been distributed very well and also been stored and a lot of things. In Nigeria, if you could look at substandard, a lot of things have contributed. We have unregulated supply chain, which everyone could just distribute any drug when he wish, and also anyone can just bring a lot of things to the market. If we see about our own, we check holistically on our own open drug market system. Everyone who is not licensed can just enter into drug market to do anyhow. So we need to put to look into our own policies. What have we done wrong, and what have those countries that are close to us have done to see these menace are brought to their minimum level.
People will be asking, or will ask, that the issue of the open drug market, it is like it's not even diminishing. It is going up by the day.
No, yeah, actually there have been a lot of issues surrounding open drug market. The first, I can remember in 2017, the federal government created a policy on wholesale, which they are pushing in place how to bring the issue of harmonized wholesale market in some regions. Kano have started, they are building a big market, which the PSN, Pharmaceutical Society of Nigeria, during the time of Miyakase, have done a lot of things. The PCN and also the federal government have done a lot of advocacy to see this. But the deadline has been pushed. The first deadline was in 2017, we pushed it to 2019, and also till date, we could see people going to Kano, Anambra, Enugu, and rest to buy drugs. Which is actually bad for our own system, because these things contribute a lot toward our economic impact, the health impact, and even if we look about global health security, people are spending a lot of money which are not being put in place. You spend a lot of money to see you cure, while there's a lot of effect going on.
Billions of naira have been spent for the importation of drugs. For example, antibiotic has the highest in recent years, part of the things Nigeria import from so many countries. This issue of unregulated supply chain, the issue of open markets, the issue of storage, who should be responsible to take care of this?
Yeah, like I've said, everyone has a role to play in this aspect.
But there must be a government agency.
Yeah, exactly.
There must be
like I've said, like
sole
you have
responsibility is to do that.
Yeah, everyone in the chain has a role to play, but the federal government or the government have a key role to play. Like you have said, the global market of this falsified and substandard medicine is actually due for over $200 billion in 2019, which Africa contribute a lot towards it. If you could see, 48% by WHO said that, and also the World Customs Organization have said that 48% of these falsified and substandard drugs are from Africa. So also, if you could see this all framework that you have talked about, everyone has a role to play, because in our society, if you could see the government, they play a greater role to see this economic burden is reduced through bringing policies, regulations, and also to enforce them. We have those these regulatory agencies, but they have not been strengthened to use the framework they have. The last time I saw a report by WHO and also this World Customs Organization said that almost 50% of this drug have been brought by digital health. People go online to sell fake medicines, which is actually not being used in Nigeria. But things have started. The last time I checked online, I saw a lot of things like organizations selling drugs, or online merchant doing business of drug, which is actually beyond our own scope. There have been a lot of debate surrounding how they operate within their own policies in the country, but there have been a lot of feedback from these regulatory agencies that they don't have the regulatory framework to regulate those online merchants, bringing them down. So it's fall on government to see how they could bring about policies that could regulate. There's one policy that have been in place, the PCN bill, which was brought to the president to be signed the last Senate, the 8th Senate, which was approved by them, but still haven't been signed. So one of the advocacy we need to push is that to see Mr. President place assent to this PCN bill so that it could bring the issue of falsified and substandard medicine down.
Well, looking at the issue of, you say people have a lot to contribute, but people are the consumers. How can they contribute? Looking at the fact that they are the consumers. If they are sick, they go to pharmacy. If they are sick, they go to see doctor. The doctor recommend or prescribe, then they go to the pharmacy and buy. While those that are even patronizing the open drug markets, and they will just go and get, how will they?
Yes, you see, greediness and also the economy contribute a lot in this aspect, in the sense that greed is only greediness that you see people buying drugs that maybe companies doing promos, maybe 2 months to their own shelf life. Maybe you are buying antibiotic that should be taken 10 days. You see people buying stocking these drugs that are being sold at the end of their own shelf life. This shelf life, maybe the expiry date is ending maybe in 2 months time, but you see actually people going to buy this drug to sell to the public. So they recycle them. They recycle this drug to reflect on a date that are not good and to sell to people. So we contribute this to ourselves, and also the issue around also the economy. There's a lot of issue because there's actually out-of-pocket syndrome, out-of-pocket payment, which people doesn't have money, but they go to patronize people on the street because we have a lot of hawkers. There are a lot of people that sell drugs. We need to actually start to have this attitude of going toward professionals to buy our drugs, to also buy medicines from them and also medical product, because you can't go to a hawker, you just see people because he's cheap, and also because things are just anyhow, you just go to court maybe antibiotics. It has contributed, like I've said, global health security, that we are facing an issue also because of this menace of antimicrobial resistance. Antimicrobial resistance is in the sense that we are taking antibiotic that doesn't work for us, and there have been the science has actually come to a stage that there have not been a lot of development in the issue of antibiotics. So this we contribute ourselves, that we are prescribed maybe drugs for 10 days, for 1 day, for 5 days, but we take for 1 day because we are well, we just leave it. So this attitude from the public also need to change, in the sense that we need to start going to professionals to patronize them for our own safety, and for quality of life and for quality of our own money.
Before now, during late Professor Dera Okunyele, a lot of people saw how she fought this issue of fake and substandard drugs. And also the Pharmaceutical Council of Nigeria have been closing down or registered pharmacists or chemists and across the country. But why is it that we still have those or registered or unprofessional pharmacists, as well as those that are still in the open market and nothing has been done?
Yeah, actually NAFDAC, and during the time and also now, they have been doing a lot of things, and also the PCN have done a lot of things. Nigeria is almost, we could see we have almost 774 local government, and majority of this burden are being pushed to rural areas because they are out of reach of this, quality medicines, regulatory agencies, and also surveillance system. It's only rural areas that you go and see maybe there are pharmacists, there are chemists, and also there are drugstores that are being unregulated. If you could see there are no reach of these regulatory agencies in rural areas. So people tend to operate anyhow in those places than in urban or peri-urban areas. So when you look about their own workforce, during those times the trend normally changes. every day you can't say PCN can be in every local government. So we need to increase their own workforce and also to strengthen their capacity and capability to see they are into all places, all rural areas and undeserved areas, to see there are a lot of things, there are a lot of changes. And also when those enforcement have been put into place, the judicial system need to strengthen them to see they are brought to book. There are a lot of times, even last week I saw there have been a lot of clampdown on a lot of pharmacists and also chemists in Kano. But when you go back, maybe the judicial system, when they have been taken to court, it takes a long time to implement those punishment that to be served. Or there are places that are out of reach of these regulatory agencies. When you close them tomorrow, they will continue. So there are people that doesn't have these professional capabilities to do all those things. So, and the outreach of these agencies are not put into them. So when we have to start to look about how we could strengthen this workforce of these regulatory agencies, that they need to push every day into those places, so that when this enforcement have been placed, tomorrow we continue. Not that we push in proactive measures that we do places today and go back or maybe in the next years. So we need to do that.
Now the president says in his 1st October broadcast that we'll have pharmaceutical independence. Is it realistic?
Yeah, it's actually, I can't really say if it's realistic, but if we push in any way, it will revive our economy and also increase our healthcare delivery. If you could hear about his speech, on his National Day speech, he said there's actually a transition shift to strengthen pharmaceutical sector. It's actually a welcome development because local industry will help our economy to come back and also increase this healthcare delivery, because people, one of the things I have said is that the cost of out-of-pocket spending in our healthcare delivery contribute to this maintenance, which people doesn't have money. If you could see, the minimum wage is just paltry, less than $2 per day. People doesn't have those money to spend money on their healthcare services. So the more they don't have money, people try to patronize this substandard and also falsified medicine. So bringing about local industry will shift this transition from where we import drugs and also exporting these APIs that we have. Because in Nigeria, we almost export all these APIs, despite that we have a lot of pharmaceutical manufacturing industries. We have almost 121 now, we almost have 160 something industry in Nigeria. But most of them go outside to buy API that would produce in Nigeria. As common as starch, as common as this integrant that we produce here, we refine them outside and also brought them back because we don't process them here. So investing in that will reduce the cost of healthcare delivery, in that people can access good quality medicines. It will increase availability, it will increase affordability, it will increase even access to essential services, because when we have this in abundance, we have this anti-malaria, people doesn't have to push. We can also access this surveillance system anywhere, because NAFDA can just go at any time to this industry to sample those products and know how they are going, and also sample those products to see how they are there and compare with their own standard they have. So when we have those in place, it will increase the service delivery, and also it will transform our own healthcare services, and also increase even employment to this professional, and also increase service delivery in capacity development to professionals like PPMVs, to this open drugs to arrest.
How can people know this drug is falsified or is a substandard?
Yeah, actually that's one of the key problems we are facing in Africa and low middle income countries. In 2017, the European Union compelled all European countries that one of the things they should do on every prescription medicine and also all medical product is that they should bring about mass serialization and also digital health in confirming the availability of this, the authenticity and also quality of this drug. So when you look at Nigeria, the only thing we have is only batch number and expiry date. This can be recycled because this is on a carton, and also this is something that everyone can check the batch number or even fake it. There was some sort of improvement in the sense that in 2019 also, after that European Union, the African countries went to create an agency, African Medicine Agency, which they created with a framework that they should combat this falsified and substandard medicine. But one problem is that how could you combat falsified and substandard medicine when you don't have adequate surveillance system to checkmate that? The health literacy level is very low because there was a time that we started in Nigeria that we normally use this USSD code to confirm. But it's drugs that you see they are from outside or highbrow drugs like high brands that does that. When people doesn't have such amount of money to maybe patronize the real augmentin, they'll go to buy a drug that you can't even call its name because the prices are very low. So there is no surveillance system because all over the Africa and also Nigeria, the main accessible place to buy drugs are these drug hawkers, especially in rural areas. So the people that are selling drugs, they don't have the knowledge. They don't have the expertise to even verify those availability. So how can you tell also a rural person that doesn't have the energy or doesn't have even the knowledge to also authenticate this drug? So we need to push around our health literacy level to sensitize and make people around rural areas aware that even when we have this digital platform, how could we use it? Despite it is free, but how could we use it? We need to do that. And also we need to actually bring about maybe digital health in securing maybe we have chip pins, we have maybe scanner barcodes, and maybe these pharmacies and also medicine stores to see if they could use them. They are very cheap. It's just you could put scan code that you know the authenticity. But we need to actually make people aware and sensitize them that don't buy this drug if it is not having this barcode or it's not been scanned in your presence to do that. That's the only way we could know that this drug is either authentic or is substandard or falsified.
Well, we keep saying federal government, federal government. Wouldn't state government also have a role to play in ensuring that those rural areas have been taken care of in terms of tackling this issue of substandard drugs? With the figure of about 9,700, for example, in the northern part of the country, in the whole country, about 12,000 plus are dying because of this, and a huge amount of dollars or a huge amount of billions of naira have been lost because of this. Wouldn't state governments also do something?
Yes, the state government have a key role to play in the sense that they could actually improve the capacity of these regulatory agencies in their own localities or in their state territory. And also the state government, like at this point I would like to commend the Kano state government and also Kaduna state government. They have actually done a lot of things. The Kano state government have done a lot of things in seeing that there is an organized wholesale market which is actually been in place in Kano. And also I saw some few weeks there's Kaswa Magani in Kaduna, which Governor Erufai has done a lot of things to see this coordinated wholesale market has been in place. Like I've said, improving their capacity, creating those organized market, and also strengthening this workforce of this. And also in an instance that if within the ambit of the law, if this state government can do is to create an agency to checkmate the activities of these regulatory agencies and also what is happening. Before, I know in some state government they do have the state CPC, consumer protection agencies, in collaboration with this FCCP. They have also the legal backing and also the SON, Standard Organization of Nigeria. They have those mandate also, not only NAFDAC, maybe the PC, and to do those things. We have a lot of agencies, but the main thing is that who is going to do this, who is going to do that? We don't have it. When the government is going to do that, if the government can also improve in their own surveillance system to create electoral agencies and also give them the appropriate equipment and also capacity to do a lot of things like that. So it's a welcome development for the nation, I think, which will increase the synergy of these menace to bring it down.
Do you think the punishment meant for anybody found selling substandard or falsified drugs is enough?
Yeah, in this instance, It's not really enough because our judicial system is not being into place. We need to bring about special courts that will be in place for trial of people selling this falsified and substandard drug, because it's not only for the person. It doesn't also it bring about physical harm to the person, financial harm. It bring about economic sabotage. It bring about health impact. It bring about also national sabotage, because you are increasing burden on the global health security. We could also see in those this issue have bring about reversing the gains we have actually pushed in so many sense. We have seen so many times there are falsified HIV drugs, there are falsified tuberculosis, anti-malaria. These are countries like Nigeria that contribute a lot, more than any country, on the prevalence of malaria. And we can't be saying that it's only plasmodium or so that contribute to this burden. Also, this falsified medicine contribute a lot, because people have been spending a lot of money, but they have been using the wrong drug in place. So also people have been sabotaging the economy because they are selling things that will kill people, and also putting the burden on this global security. So we need to actually bring people down. We need to actually bring things down within our own ambient law to see that if punishment will serve to bring decrease in the problem, so we need to do it beyond punishment itself.
You are a pharmacist. What are the roles, or what is the role of pharmacists in tackling this issue?
Yeah, pharmacists have the major role in tackling this issue, because they are the custodian of drugs, and also not only drugs, medical products. Because when we talk about medical product, it deals with vaccines, it deals with equipment, it deals with medical also procedures, arrest. So when you talk about pharmacists, who is custodian, the government need to clarify on the role of pharmacists. If we are talking about supply chain, pharmacists are expert in that, in moving drugs from one place to another. We need to bring these professionals. We need to put professionals where they are, to see that these pharmacists have a greater role to play in those places. You couldn't put any person that who is not professional in that. And also, if we bring about the sales of drugs, I'm not saying pharmacists are the only people that should do that, because we don't have the capacity, we don't have the numbers to say that we can actually serve like 200 million people in bringing this down. But we need to bring about professionals who have the capacity, who have the knowledge, who have everything in bringing drugs safe, affordable, accessible, and also essential drugs are being placed to where they are. And also government need to bring about a special consideration for pharmacists in rural areas, because you could see there are not a lot of, if you go to rural areas, hardly you could see pharmacy or pharmacists that are in place. There need to be special consideration, or even if it bring about incentives to bring pharmacists in those places, so that there will be that safe access to medicines in place. So also, and they need to be increase in workforce. There are less pharmacists, because if you could see about the ratio of pharmacists and the population, is also less than what the WHO has enshrined, which is one ratio, almost 40,000 or 20,000 people in Nigeria. One pharmacist cannot serve them right. So that's what bring about different professionals to key in to see what they, and also the issue of what they say around people operating pharmacies. Maybe pharmacists giving their online signal. So it's actually bad, and especially young pharmacists. I will acknowledge them. I will acknowledge them. They have actually bring the issue of maybe registering pharmacists and going somewhere for someone to bring to a down level. And also in places like in these urban places that have been raised into pharmacies, government need to place incentive like they have done in this COVID pandemic to assure them that pharmacists have a key role to play in providing primary healthcare delivery in system. So they need to be in place, even it bring about giving them loans, giving them recovery, because we just face a pandemic that people are down in every aspect. So also, if government can push money to see they are being brought back to the community to serve them, this actually again to the society and also Nigeria in general.
Then it says the substandard and falsified drugs lead to issue of kidney diseases and some issue even like liver How true is that?
Yeah, it's actually true. A lot of drugs, like every health professional knows, they are being metabolized or excreted in other parts. So when you take drugs that not only falsified, maybe substandard, that have deteriorated, these are chemicals that have deteriorated, your kidney can't filter them because they have actually changed from one form to the other. So also, this falsified, someone has just falsified a drug or adulterated the drug. So you can't just say that it doesn't have, it have a problem to the physical and also the whole body, which is actually not beneficial. That's one of the key things we have been seeing in the rise in kidney injuries, which places a lot of burden to our system, because money, the government has to push a lot of money to our health system, to dialysis, to a lot of paying money to even cancers and rest. So when you take a drug that is very harmful, it brings about cancer, kidney injury, liver problem, and also even physical injury. People, you see, they have deformities. Maybe not only you, and also maybe your own unborn child, they are being transmitted. You have, so it places a burden not only to you, to the even economy, and also to the nation in general.
As an expert in the issue of drug abuse, what will you say about Nigerians engaging in drug abuse or self-medication? Let's start from that.
Yeah, self-medication, it's actually something that have been very bad, and it's actually keep on rising, because the issue of drugs are just there. There are no professional to say they are there to manage them, or to see them how effectively they are not being used. Like we have been saying, this drug distribution channel, if we don't regulate it, we are in deep shit, and we will actually see the effect in the nearest future, because everywhere you go, you see people hawking drugs, people selling drugs abnormally. People are just taking drugs despite not knowing how harmful they are to their own body, and also how harmful they are to the whole society. People take drugs. We are increasing our issue in antimicrobial resistance, in this issue around healthcare services delivery. People are abusing them, people are misusing them. So there are a lot of burdens. If we start to quantify them, we actually can't quantify the issue of drug abuse and also misuse to our own society. The main thing is that we need to actually keep pushing, despite that with the regulatory framework and also government have been keeping pushing. So we need to also keep pushing to see we brought this menace down before our society face the consequences.
Recently, General Marwa, that is CEO of NDLEA, says that Lagos, or the Southwest, has the largest number of people engaging in drug abuse. And also in 2019, we saw the report of the large number of people also engaging in Kano State in particular, as well as the northern part of the country. What would you say to the youth concerning drug abuse?
Yeah, drug abuse has been an issue for the kids, and I'm very happy because in 2018, the United Nations Office on Drugs and Crimes presented the first ever evidence-based comprehensive survey, which actually showed a clear picture of what we are looking at, despite that some people doesn't think that it was more comprehensive. But it actually gave us a framework of what are we seeing, what is our own future, and how can we act now. Also NDLEA, General Marwa has been doing a nice job. He has been doing a lot of clamp down on those issues. But beyond clamping down and also beyond what they are doing, we need to actually start seeing how can we strengthen our own health system to see that we don't have a generation of addicts. Because when you take someone, you give him a punishment or stringent measures, and taking him to jail or punishing him, he go there to actually learn new measures. But we need to actually put this health system whereby people that need to go to rehabilitate themselves, we actually have professionals who can advise through their own, to advise them to see they overcome their own mental health, they overcome this addiction, to bring back them to their own society safe and very okay. So this is one of the key issues we seems to have forgotten, is that we need to have those measures into place. Into that, we need to bring about awareness. We need to bring about sensitization. We need to bring about this issue of rehabilitation, and we need to bring about bringing people close to the public. on seeing that they are bring back to the society without stigma, without any issues them being faced. Because if you look about the survey, they say 1 in 4 drug abusers is a woman, and also 1 of 5 people they have tried to get rehabilitation, but they couldn't find. When we look about our own society, especially in our own places, in maybe the northern Nigeria, there have been less rehabilitation agencies, and also the regulatory framework have not been keep pushing on seeing these people have been rehabilitated. The more often we do is that let us take them for punishment or stiffer measures. We need to start looking about what are these community-based things we need to bring about in place, and what are these scientific measures. The actually developed country has done a lot in that regard. There are a lot of measures like the morphine, also this opioid. There have been a lot of measures that have been in place that people can just can be brought back to society free of this addiction through a lot of measures. So we need to actually see how we could do that. And also their mental health, and also this our own psychiatric centers, psychiatric hospitals that we have are very less. We have less professional, this psychiatrists, also these psychologists who are there. We don't have the numbers to say that in every society we have them, in every community that will help this addict. So we need to start training and also building capacity around those places, I think.
All right, still my last question, and this has to come on the issue of the drug abuse. How will somebody get to know that he is becoming a drug abuser, and also what he or she should do to actually stop?
Yeah, in this sense, there's difference between what we call drug abuse and also drug addiction. Addiction is in the sense that maybe someone has been taking drug in a sense that maybe he got addicted to a level of dosage. Maybe you are taking a particular dosage to a time that when you take it, it doesn't tolerate in your body, that the threshold has been pushed, that you need to take another one. So that's one of the things that we have in this opioid, like this morphine, codeine, and rest. We need to actually see how we could when people are being addicted, we don't put stigma around them. We need to put those things in place that when they are there, we need to bring about what scientific measures that when someone is taking drugs to be brought back to society. When you talk about drug abuse, are things that maybe people abuse them to elicit either psychological or any effect or any harmful effect to the body, like maybe the cannabis, which is the most harmful thing that people normally take. People take it to arouse maybe a mental, psychological effect to do anyhow, or to maintain those thresholds. So one of the things we need to put in place is that we need to actually see these drugs are out of reach of these young people, especially young people who are. We need to actually, in the society, when you see that, the community need to bring things in place from maybe parents, from maybe society and community, to bring those people that we need to start talking about this thing in our society, that they are really bad. Because there's this menace that is happening in our society of the issue of shisha. People take it as a social thing when people may put a lot of things that are very harmful. There's a lot of time people put even the cannabis. People put drugs inside, but people take it as social, that anywhere, any joint and every places. So government need to also key into those places to see that this shisha doesn't contain those harmful substances. Or even when you look about, they are the same thing with tobacco, that people, it has harmful effect like cancer, like kidney issues. So why would I take something that maybe the society have portrayed is good, but in real sense it portrays harmful effect to you? So the society need to show to everyone that this is actually bad, and we need to remove them from our own society. That is not what we need to bring socialization to it.
In 2020, there was a WHO report that says one inhaling of shisha is equivalent to about 100 stick of
yeah, that's
cigarette.
Actually true. You are actually increasing the burden of how your lung capacity will work. This is a lung that is actually responsible for your respiration and other thermostat activities in your body. So you are overburdening it with a lot of toxins, because this smoke presents toxins in your kidney, in kidney and also the lungs. So when you actually increase so much burden on it, so it actually fails. So also it's more harmful to even the tobacco that is less, maybe 100% less harmful. The producers or also the manufacturer also plays like an instruction that people are liable to die young. So why will you take it to increase this burden to your own self? So we actually need to push away this thing out of our society to have a healthy well-being and also a healthy nation.
Thank you very much, Pharmacist Yusuf Hassan Wada. We have been discussing with him concerning the issue of substandard drugs, the implication or impact of it on Nigerians and Nigeria, which we extract a lot of issues regarding it and what should be done both by the government, the people, and also other stakeholders like the pharmacies and also the medical doctors to see how this issue can be resolved, in which the loss of lives, the loss of huge amount of billions of naira Nigeria is actually losing because of these falsified and substandard drugs, which he actually give a lot of explanations concerning that. And is Yusuf Hassan Wada is a public health pharmacist and also expert in drug abuse and health system strengthening advocate. Thank you very much, Hassan.
Thank you so much, Alhassan. It's actually a honor to be here.
All right, that's much we have for this first segment. Next is going to be another segment.